Thanks for joining us on this Friday night. I'm Lewis Dodley. We start with the pandemic as COVID rates keep falling. City reaching a 6-month low after the state reports its lowest rate since before the Thanksgiving surge. City's 7-day average positivity is now 2.41%, the lowest in half a year. The state's falling to 1.2%. We have team coverage tonight. Angie Gonzalez is live on the Upper West Side, which has the lowest rate in all 5 boroughs. Angie?
Yeah, and Lewis, with those statistics in mind, we came to the Upper West Side to ask residents exactly why they think their COVID positivity rate is so low. But we also spoke to an epidemiologist who says that this data may not show the whole picture. Mayor de Blasio says New York City is on the road to recovery.
Really, this is something to celebrate about.
During his weekly radio interview, he announced the 5 boroughs have hit a milestone. The COVID positivity rate, according to the health department, fell to 2.41%, the lowest number recorded in the last 6 months. It's encouraging news that, according to epidemiologist Dr. Dennis Nash, should be taken with a grain of salt.
It's quite possible that that the testing rates and the numbers of cases that we see now don't really reflect what's actually going on citywide. It really reflects on what's happening in the group of people that's testing.
So the question is, are those being vaccinated still getting tested? State data indicates the number of tests in New York City have stayed consistent, even as it rolled out its vaccination effort. On the Upper West Side, the data appears reliable as testing remains high, and they have one of the lowest positivity rates in the 5 boroughs at only 0.35%.
I think we're all just so eager to get out and see one another again and get back to doing the things we love.
City data also shows a significant portion of the population on the Upper West Side has been vaccinated. 76% have had at least 1 dose, 64% are fully vaccinated.
All my employees have encouraged, they're all vaccinated, all my friends, all my family, and we celebrate it.
And anecdotally, New York One noticed that most of the people walking around here were wearing masks, even outside.
It's just such a great community here. So that sense of community means everybody chips in, everybody does what they need to do to make it work.
And even the young ones around here know the COVID facts.
But they have to remember that even though you have the vaccine, you still have to wear a mask.
Dr. Nash says it also has to do with the socioeconomic makeup of the neighborhood.
There are probably fewer people that have to go to work, every day on the subway with public transportation to workplaces that may not be as safe, and more people that are able to work from home.
And residents agree.
Well, I think it's a slightly older neighborhood, a lot of professionals, pretty conscientious as well.
And Lewis, another positive sign, all the city data that records all the COVID indicators, well, they're all on the decline. That, of course, includes the number of COVID cases, but also the number of COVID hospitalizations and the number of COVID deaths. On the Upper West Side, Angie Gonzalez, New York One. Lewis, back to you.
All right, thanks, Angie.